In today's presentation, we are going to take you through our semi-automated biochemistry analyzer that we have in stock. Basically, it is a machine that is used in the medical laboratory to calculate the concentration of various particles and substances that are in the blood serum, as well as urine, as well as in the blood plasma. Basically, the machine uses the photometric principle to calculate and find out the functionality of the kidney, liver, as well as the lipid profile within the body. As well, it is used basically to calculate the electrolyte, that is EUCs, in order to determine the condition of the patient, whereby the results that are obtained from this machine, they are used for clinical purpose to determine the functionality of the liver, the kidney, as well as the lipid profile within the body. At the end of the results, it will now result to better and accurate diagnosis. Afterward, better diagnosis and proper treatment to the patient. Here, it is a Sinoa brand. It is a semi-automated biochemistry analyzer. It is very simple to use. As I indicated earlier, the machine uses the photometric principle to determine the concentration of various substances within the blood stream. In this case, the photometric principle, that's how it is applied in this machine. Wherever you aspirate the sample at the far end, that is the plasma, it passes through the flow cell, whereby the flow cell detects the light intensity that is passing through, and then it is manipulated in the electronic circuit. At the end of it, it is displayed on the display in alphanumeric. And then once it has displayed the result, you can print it out here, and then you can use it for clinical purposes to know the condition of the patient. It has the fan. That means the machine can run for longer duration without being spoiled. It has RS32. This is when you want to do software programming, and you can upgrade it the way you want. So it is a very stable machine. And this is a peristalsis pump where it sucks the waste. It passes through to the waste container. Now you just switch on the main switch. The machine comes on automatically. Once it has come on automatically, now the machine does self-checkup by itself. As you can see, the machine has done its self-check, and it has said that the machine is okay, is ready for use. Then it comes to the normal display. The machine has got the pen touch. This is to avoid cross-contamination. You just use it. It is a touch screen. You just click once. It can now come to the display, and what it does, you can be able to see. If you want to perform a test, you can click test. If you want to edit, you can edit the test. In this is when you want to do the test. As you can see, the machine is brand new. We have not done any programming of the reagents. Now that's why you can say not applicable at the moment. So the moment you will program the first test, you will be able to see it on the display. Then another part you can do, you can see there is results. This is when you have done a particular sample. Then you can come here and check the results. So at the moment you can see we've not done any test. The second one, you can control, you can print the report, you can do every part that you want to do. If you want to transfer the result, you can transfer. In this case, that is when you want to wash the flow cell. In this case, we use distilled water to make sure that it is well, the flow cell is clean. You just click wash. The machine does the cleaning by itself. Then after it has done that, we proceed further. When you want to check the printout, whether the machine has got the paper, just click once. The machine will just display, knowing that there is the printout. There is a default. That is, the volume should be, when the volume is 3000, the motor step should be 22,015. That is when you want to do the calibration for accurate results. Another part that we would like to see is Planck test. It's very key because it helps the user to know whether the machine is in accurate condition before it starts to perform the various functions. We want to do an illustration on how the Planck test is done. You just place the distilled water at the probe, and then you click the push button once. The machine will just pick the water and it passes through the flow cell. Then once you've done that, you just come and click the function read on the display. the machine will read and check itself using the various wavelengths. You can see there the first wavelength. There, the first wavelength it's okay. You can see it has the absorbance range between 45,000 to 60,000, and the offset range, which should be between -300 to +300. Now, in this case, the machine will check itself automatically. It is displaying gradually. Once it has done, you just click the function print. Then the machine, you will see, it will print the result automatically. You just click the function print, the machine will print the function automatically, as you can see. Then now, another function that we would like to take you through is about the setup. That is when you want to set the temperature display. Now you can see it is already stable. The incubator is already at 7 degrees. That is where the optimum temperature under which various tests are done. And then the cuvette temperature, that is the temperature at this end. Then you can set even the hospital name. The hospital name, which is a very key parameter. You can use an example for demonstration here. Just say no field healthcare. Healthcare, like that. And then you click the function, okay. You can see the machine have indicated that. Once you have done, you escape. You can change even the date and the time. You can set the time the way you want. After you've done that, you just go to the function and click yes to save what you've saved. You can see the printout, the status of the machine. The machine is in good condition, it's very stable. It has complied with the calibrated parameter and the software being programmed. What are some of the consumables that come hand in hand with the biochemistry? These consumables, all of them, we have them at Nofil Healthcare, and we sell them at affordable price. The first consumable, as you can see, is the one that I'm wearing, gloves. We sell them at affordable price. Another consumable that are used hand in hand is the red top vacuum. This one, they have got a cloth activator. It helps when you want to do segmentation. At the end, you get the accurate result. So you just put the blood sample when you want to collect the patient sample. You just pick the sample, then you put inside here. Then from there, since this glass, this red dot vacuum have got the activator, it will just clot within a software. You segment, then you get serum that you will use with the machine. And another consumable, as you can see, is the glass. This one, they are when you want to put a sample and the various reagent inside. You just put in the various ratio to this test tube, and then you place it on the incubator. Another consumable, they are reagents. Here you can see some of the reagents that we sell them. We sell them at affordable price. They are ISO certified. They have undergone KEBS test, and they have very long expiry, as you can see. Here it is a urea reagent, and the brand is Beacon. We sell them at affordable price, and they can help you to perform various tests when you are using. Another component that we are selling, they are micropipette tips. We have yellow tip, and we have the yellow tip and the blue tip. And the yellow tip, basically, they are used to pick sample up to 200 micro, and this one up to 1000 micro. As you can see, it is well indicated. Then another key component you can see here, it is a set. This is called a micropipette. This one is used when you want to transfer. Let's say we want to transfer 1000 micro. You just put the micropipette tip as I've indicated. Then you pick a sample of, let's say, 1000 micro. Then you place it on the test tube gradually. This one, it helps to avoid cross contamination, which will end up to getting undesirable results. And another component which is very key, they come hand in hand. This one is called a calibrator. It is used when you want to do calibration. Calibration helps to get accurate results. For demonstration purpose, we want to do a very simple illustration for a test by the name SGOT. Now, when you want to program, let's say SGOT, the machine is very easy for one to use. As you can see, the reagent has got the various parameters. You can see, you just click using the pen touch. You just click once on the display, and then you come to the function edit. You just click SGOT. Then you click OK. Then you are done. Then here you can see all the parameters, they are there. One of it here you can say it is kinetic, and another one you can see there the wavelength, they are there. This one the unit is there, and another function there, it has got 340, that's the wavelength. This one has got delay time of 60 seconds, 60 seconds. You just set it on the display. Very easy, very simple for one to set. It just takes 60 seconds like that. Then you go next step. Linearity, it is well indicated on the insert. Linearity 3.84, 3.84 UL. It's the unit. Then on the higher, you just set it there. That one you can see it is up to 300. So you just click 300. You just click 300 and then OK. Then there is also where when you want to do zero setting, a Planck test. It is where indicated here, Planck with water. As you can see on the machine, is already Planck with water. If we had another reagent which requires, you just click there. You can click reagent, serum. But for this case of SGOT, the instruction manual is indicating that we use Planck with water. So we set on our machine Planck with water. Then we proceed. In this one, you find it in the user manual. The machine is ISO certified and it comes with the certificate. You can see the checklist. This is the user manual, as you can see. This one, it helps the user to know how the machine functions. And then it also comes with the checklist. The checklist which is certified for what the machine comes with. This is the checklist and the serial number of the machine. And also on top, the machine comes with the certificate, warrant certificate. As you can see, it has a warrant of 2 years. Within the warrant, we can be able to support you technically just for free without any charges using our factory trained engineers who will help you to do the various calibration, quality control to ensure that you get accurate. Then on the instruction manual, you can find the normal ranges. Normal low in this case is 0 to normal high, which is 40. In this case, you just click 40, that is the normal high. So if you find that the sample that you are performing a test is not within the range of 0 to 40, that means the patient has got an underlying complication associated to liver, because this is one of the key parameters of the liver function test. Now, once you have done with the programming of SGOT, you just click on the machine, the function, done. And then the machine will just request you, do you want to save the program? You just click yes. The machine, now already there is one part that you've not set. Now you can say the linearity. You come back. The machine is out, that's why it has detected any deviation. Linearity should be up to 300. You just click here. You just click. So the machine is very sensitive. It can be able to see where there is a challenge and it will help you to do the setting, and then you correct that. The machine has saved the function parameter for SGOT successfully. You just click here to check whether it has saved that program. Then you can see SGOT now it is on the program. You just click here, just print, it will just print the program automatically. That is what you've set. Having programmed the test SGOT, now we want to perform the test for SGOT because already the machine has got the program for SGOT. In this case, the procedure is well indicated here. You just add working reagent of 1000 micro. In this case, SGOT has got 2 reagents, that is reagent 1 and reagent 2. Now you go to the user manual where they have indicated preparation for working reagent. It is well indicated here, working reagent preparation. 4 portion of reagent 1 you mix to another 4 portion of reagent 1 you mix to 1 portion of reagent 1, reagent 2. So this is reagent 2 and this is reagent 1. So in our first case, we use the micropipette of up to 1000 micro, whereby you just use the yellow tip, you just put here, then you pick 1800 micro, like that. You set it at 800 micro, then gradually you pick 800 micro of reagent 1, gradually. That is 800 micro. You transfer it to the test tube, like that. That is part 1. Make sure that you place it separately to avoid contamination. Then step 2, you add 200 micro of reagent 2. 200 micro. Like that. Then you pick reagent 2 gradually to avoid close contamination. Just click like that, the function, pick once. That is 200 micro of reagent 1. Then you transfer the 200 micro to reagent 1. Now we have our working reagent. You mix it well, gradually. Then you put it on the test tube. Using this control of ours, you just click like that. You pick 100 micro of our sample. Then like that, this is our sample. In our case, we are using the control solution. You just mix it together. Now we have our sample and reagent at the same time. Once you've done that, now you go to the machine because it is indicated. You mix well, you incubate at 7 degrees. Then after that, click once. Then you come to the function test. Already we have SGOT because it's the program that you have programmed. Just click SGOT. After that, now you go procedure. Once the machine is very sensitive, you have to make sure that the flow cell is very clean in order to get the accurate result. So you pick your distilled water that I told you that we have them in stock. We sell them at affordable price. Pure distilled water. Then you use this distilled water, you just aspirate once. The machine is asking whether you aspirate, click yes. Then aspirate the distilled water. You just push once, the machine will just suck the distilled water gradually. As you can see, it is within the range. Best water plant, you click yes. Then you click once, you aspirate that one once. It's done. Within some few minutes, the machine will display the plant. Already it has displayed, it has passed. So you proceed, you can see it prints automatically. Then you continue. Now the standard, in this case the machine was having the factor, so you say no. Then you write the patient name. In this case we were using the control. Now we just indicate control normal. You just click continue. You can see it is plotting even the reaction curve. You can see there is a curve that it has plot. Then you have spread our control solution once, like that. Click once. The machine will just aspirate automatically. Using the photometric principle, the moment that light passes through the flow cell, it gets converted through a transducer into electrical signal, which is later manipulated in the electronic circuit, then displayed on the display in alphanumeric as the result. Then within a short while, you will be able to see the results of the control displayed on the machine. That is, the machine takes 30 seconds to display the results. Within some few minutes, the machine have already displayed. It has displayed the result. So from there, you just click there, you go backward. Now then you can now exit. Yes. Then you come to the result, you find your result list, then you click print. You click print, the machine will print automatically on the display. So it is a very simple. You can see the result is normal. If it is for the case of the patient who has complication, the machine could have given extremely high result or extremely low result. From there, we can be able to tell the condition of that patient, whether he can go for the liver checkup or he gets medication associated with the liver. So the machine is very crucial in the laboratory for the purpose of diagnosis. So the machine comes with the centrifuge. This one is basically used when you want to centrifuge the blood sample in order to obtain serum. This machine at Novil Healthcare, we sell it at affordable price. You correct the sample, you put it inside here. Once you have put the test tube here which has the sample, for it to balance, you put it here. The machine uses centrifugal forces to sediment blood sample so that you can be able to obtain the serum. After that, you close, you set the time. If you want to centrifuge at the speed of 4,000 for like let's say 10 minutes, you set there, the machine will perform the function efficiently. Afterward, you use the sample that you have obtained. Now you obtain, let's say, serum. You have obtained your serum there. After obtaining the serum, you use it to perform various tests. all these products, we sell them, and most of them we distribute within our country and even outside. We ensure that we provide high quality products. As you can see, all those consumables that are associated with the biochemistry machine, we have them in our office. As well, you can find the machine like the centrifuge. We also have it in our stock. As Noville Healthcare, we look forward to working with you to ensure that you are satisfied and you provide to all your patients the accurate results which has been verified, quality control done, to ensure that you give accurate and appropriate medication to the patient. For today, we had the semi-automated biochemistry machine, which is mainly used in small clinic and health centers. In the next tutorial, we will be able to elaborate more about fully automated biochemistry machine, which is basically used in the middle and high-end hospital to provide accurate results. Thank you for your time. We look forward to partner together. Thank you.